Good morning, everybody, and welcome to Tuesday Training. I hope you're having a fantastic week. As always,
we are live from Austin, Texas, right here at Insurance Syndicate headquarters, and man, we have a great show for you.
Good morning. Good morning. What is going on, man? Hope everybody's having a great Tuesday. Do me a solid, drop it in the comments. Make sure that you can hear me loud and clear. Everything should be firing perfectly. But hope you guys are doing well, but drop it in the comments. Can you hear me? And where are you tuning in from? It's always nice to know where some of you guys are at out there in the neighborhoods doing your thing. But I hope you're having a fantastic day. I don't have a ton for you today. A little bit of news, a couple of Facebook posts that I wanted to go over, and then maybe little updates on some of that Medigap scripting that I was talking about last week. So with that said, as always, this show is brought to you by DFY, man. DFY CRM is the CRM of choice. I see it posted in these Facebook groups all the time, like, hey, who's using what for a CRM? Is anybody using Go High Level, blah, blah, blah. Yeah, a lot of us are using Go High Level. It's probably the highest or most widely used platform that's white labeled in the insurance industry. I'm using DFY because I like the custom build outs that are already inside the platform. And we've got some really cool stuff that we're doing. We're going to be integrating mailbox power with it, AI voice, T65 locator app. Like, there's a lot of amazing integrations that you can do with Go High Level and certainly with DFY to streamline your marketing processes. So we're going to be, not to give it away too much, but we're going to be using the T65 locator database, which if you're not familiar with it, you should probably get familiar with it. It's $20 a month. You get to pull 500 T65 records every month, name, address, phone number, and the month that they're turning 65. So we're going to be using that in conjunction with mailbox power to create an automated mailing process based on a certain cadence and the month they turn 65. So super excited about that one. But that's some of the things that you can do with platforms like DFY. So if you're looking for a CRM, you're looking for some upgrades, look no further, man. Give us a holler. We'll be happy to help you out with a demo, and certainly you can reach out to my good buddy, Eric Fierro. Speaking of Eric Fierro, he is one of my partners with the Invictus Conference. There's a handful of us that put this thing together, the Alianza de Agentes Latinos. That event is coming up in about 40 short days. We will be at the Royal Sonesta Hotel in Houston at the Galleria area. Beautiful hotel, right in the smack dab area of the Galleria. So you have all the beautiful Galleria restaurant shops around you for some extracurricular activities. But super excited about the event. I don't know what Eric's going to be speaking about, but I assume it's probably something to do with automations and AI. So get excited for that, man. But if you are looking to check out an excellent conference, now, Invictus is a little bit different. All the material comes out in Spanish. It is the only Spanish language insurance conference open to insurance agents of all lines of business, right? So we've got property and casualty people that are going to be there coaching breakouts, teaching from main stage. We've got advanced market people. We've got Medicare people, ACA people, life insurance people, little bit of everything, and certainly some excellent marketers. So as long as you can understand Spanish, or you want to get you some translator buds, I got the ones from, I can't think of the name of the group now. It's Time Capsule, I think is what it's called. And they have a little app that you can get for your phone with the earbuds, and it'll translate in real time. The first year we threw Invictus, Sam Wolf was sitting in front stage, had his rocking, said it worked great. He could understand everything at the conference. I think Joanna Wyckoff does the same thing. She comes to the Spanish language conference, rocks the earbuds. She can understand everything coming right off of the stage and from the breakout. So that is always an option, because the event is certainly open to anybody. Just understand that the information coming from stage and being taught in the breakouts is going to be in the Spanish language. All right. With that said, I got a little bit of news that I want to run through real quick. And then I got a couple of Facebook posts that I want to talk about. And then If we have some time, I might jump into some Q&A or talk a little bit more about some of the Medigap scripting. But for those of you out there in the PNC world, and certainly for those of you driving Teslas, check it out. Tesla insurance rates are set to spike as the cars become vandalism targets. I'm sure some of y'all have heard about this. People are setting them on fire. They're spray painting and vandalizing all these cars. So apparently now that problem is becoming, I guess, a massive issue, right? Or a trend. Apparently insurers are going to start changing the numbers on Tesla cars. It says right here, Tesla owners, brace yourselves. Your insurance premiums could soon be more expensive. No, it's not because parts suddenly got harder to find. It's because owning a Tesla in Elon Musk's Doge era is now riskier than it was 6 months ago. Tesla owners are finding themselves to be targets of vandalism. We're talking about cars being spray painted, set on fire, windows shattered, and even being shot. Fairly interesting. I'm not going to go through this whole article with you guys, but obviously this could increase rates for Tesla owners. Pretty simple. I'll drop that article in the group. You guys can check it out and bicker over it, whatever you want. But that's one there. And then also, as always, I love to point out a little bit of fraud. So we've got this article that just came out. This is actually in Tennessee. So, and I can't get rid of this banner at the top, but hopefully you can see this. But basically, Rome, Georgia, a Tennessee doctor who also practices in Georgia has settled claims that his office knowingly submitted false claims to Medicare for medically unnecessary therapy. So when people say there's not fraud, waste, and abuse in Medicare, I always like to point out that it's rampant. And it is not just at carrier levels where maybe they're doing upcoding, right, to maximize diagnoses so that they can get reimbursed. That's obviously a problem that we're aware of. There's many lawsuits that have been going on at that. United Healthcare just won a lawsuit on that topic. But you also have doctors that are a big part of it. And I'm not picking on doctors necessarily, but there are definitely some unscrupulous doctors in different ways out there that are overbilling Medicare, billing Medicare for things that are medically unnecessary, and then getting payments on it. It's really rampant in the durable medical equipment space, but also just any other doctors. So I always like to point it out so people are aware, and this is just another instance where it says right here that the United States alleges that between September 2009 and January 2017, Dr. Robert Burkitt billed Medicare for administering the chelation drug etitate calcium disodium to Medicare beneficiaries who were not suffering from lead poisoning. The drug is prescribed to people suffering from lead poisoning and lead encephalopathy and is rarely used. So the U.S. Attorney's Office alleges that Burkitt falsely represented to Medicare that his patients suffered from lead poisoning or other heavy metal-related diseases to avoid Medicare's restrictions and get reimbursements. Burkitt and his practice will jointly pay $700,000 to the United States, which will be used as restitution to Medicare. Go get them, I say. Let's move on. United Healthcare sees a fight. This is from Axios, but United Healthcare sees a fight coming over Medicare Advantage. Yeah, I bet they do. Medicare Advantage has been a hotly contested item for years. Pretty much every administration, there's some back and forth on Medicare Advantage. Ultimately, when we look at the trend all the way back to like 2005 when Medicare Advantage started, it kind of came out hot, got reprimanded really hard. And then starting about 2013, 2014, and I would really say 2014, when the subsidies started getting increased on Medicare Advantage plans, we've seen them increase every year pretty much since then. It's obviously taken off, and it is the dominant, almost default enrollment platform for most Medicare beneficiaries. I believe it is something like 51.5%, 52% of people are enrolled in Medicare Advantage plans. But United Healthcare says they see a fight coming. And part of this has to do with Dr. Oz. As you know, Dr. Oz has been going through his confirmations as the administrator of CMS, the Center for Medicare and Medicaid Services. And he made some statements that a few people are a little up in arms about, few people are concerned about, agents alike. There was some chatter that he felt, or he made some statements regarding abuses in Medicare Advantage and that agents are responsible for some of those abuses. I think a few agents got a little bit exaggerated over it, thinking that he's targeting us and he's coming after us. But I've talked to a few other people and they're like, no, that's not it. He's talking about upcoding practices, things of that nature, not so much agent abuse. But I wouldn't, like, one of the first things that a lot of us thought out in the Medicare space was that as soon as this Republican administration came in, right, pro-capitalist administration, we're all like, dude, gravy train, we're all going to be killing it. They're going to be super pro Medicare Advantage. They're going to increase subsidies. They're going to help blow up the plans, more benefits, less regulation, more streamlined processes for agents. And I still think a lot of that is very possible, but I don't think it's as guaranteed as we thought. And certainly I'm going to continue to follow some of this stuff and get more news out to you guys as things evolve. And I got a couple more articles to share on it. But Dr. Oz is going after Medicare Advantage in a lot of ways. He made some statements specifically that he is really going to dig into the practice of upcoding, which, if you're not familiar with what upcoding means, that is basically when you as a patient or a Medicare beneficiary as a patient goes to see their doctor says, well, you have this is the major problem, the reason that you're coming to see me. But we also see some of these diagnoses, and they'll add these billing codes onto the visit and upcode that doctor visit so that they can maximize the money they're getting in reimbursements from Medicare. This is not an uncommon practice. I have been, I don't know when I want to say victim. I've been victim of it as myself, not related to Medicare, but I remember going to see my doctor at one point, and this was many years ago. I can't remember specifically. I think I had a skin tag on the back of my leg that I was going in to see him about. I might be off on that. It might have been some other reason that I was seeing him. And he immediately just asked me, when was the last time you've had a tetanus shot? And I don't even know why it came up. I hadn't been stabbed with anything. I haven't didn't step on a rusty nail. And before I could even answer, he's sitting beside me, hitting me with the tetanus shot. Why? Well, because he gets reimbursed for every one of those tetanus shots he sells. So there's a lot of people that are guilty of it in different ways, right? Doesn't just have to be Medicare. But upcoding is a practice, and Dr. Mehmet Oz has stated that he is going after it, right? So right here in this article, it says the United Health Group is bracing for scrutiny from the Trump administration over the way it and other Medicare Advantage insurers bill the government, along with other cost-related topics. So why it matters, Mehmet Oz's characterization of the Medicare Advantage system as upside down during his Senate confirmation to become the Center for Medicare and Medicaid Administrator has surprised people. And I would agree. I think most people would be surprised because he's generally been a champion of the Medicare Advantage program. And then when he's in there getting questioned by the Senate for his confirmation, he says, hey, it's upside down. The Medicare Advantage system is upside down. Those are not necessarily a lot of the words that we would like to hear. We would like to hear that he says, I can clean up Medicare Advantage, tighten it up, make it better, improve prior authorization processes, and grow the program even better. But instead, he's like, it's upside down. We got to work on it. And the big thing, he says, I pledge, if confirmed, I will go after it. And he's talking about upcoding. And I don't disagree that he should go after upcoding 100%. Like, we need to make sure that the doctors, the providers, etc., when they are billing Medicare for services, that they are not adding codes to that claim or to that bill or to that diagnosis just to fatten their pockets. That's bullshit. So I agree that he definitely needs to go after it. He also brought up prior authorization in Medicare Advantage, saying it could be streamlined and is a pox on the system. Definitely, there could be ways to streamline that. He floated limiting the number of procedures subject to prior authorization by insurers at 1,000 and said reviews should happen more rapidly, including through the use of AI tools. So he wants to create some limits on PA prior authorization. Maybe we put a cap on the number of items that can be PA'd or need to be prior authorized. And then finally, reviews should be able to be more streamlined. Blue Cross is working on this. I talked about this probably 6 or so months ago Blue Cross is doing a test. I believe they're starting with Blue Cross in California, and certainly all the Blue Cross entities are pretty much separate. But as I remember, and I'm going off memory from the article, Blue Cross of California is working on a AI system for prior authorization that will streamline the platform, make it a lot simpler, etc. And this isn't the same AI platform for prior authorization that just auto denies stuff, as people were accusing United Healthcare of using, which I don't think was actually fact. But Blue Cross is one of the carriers that is ahead of the curve on testing out new systems to increase the accuracy and efficiency of prior authorizations. And certainly Dr. Oz is in support of streamlining that process. And I think we all would be, right? We definitely have to have prior authorization, because if we don't have prior authorization, we're going to have doctors just like this guy I mentioned that are just ripping the system with whatever they can code and get it going, right? It's already a problem, but there has to be a certain balance of what really needs to be PA'd and what does not, right? So you can go through this article a little deeper. I'm not going to jump through the whole thing, but basically it just kind of points out that Dr. Oz is definitely going after prior authorization. He's definitely going after upcoding, and he is not the giant fan of Medicare Advantage that we may have thought he was, that he's just going to come in, inflate the subsidies for Medicare Advantage and blow it up again. He is coming after to scrutinize it and look at it and tighten it up, because he believes two things. One, he believes, and the primary one, which it says in here, I know it's in here somewhere, but basically it says that we are already spending more money. Medicare is spending more money to cover people on Medicare Advantage than it is on original Medicare. And I've seen that debate several times. There's a bunch of professionals on both sides of the fence there that are saying Medicare Advantage costs the government more money, and other people are showing data. They're like, no, that's actually not true. It saves a little more money. And then there's another argument that like Medicare Advantage increases positive outcomes, positive health outcomes. And then there's another says, nope, more sick people are on Medicare Advantage and they're not getting the positive outcomes. So it's really close to a 50-50 in my opinion, based on all the data I've seen. I can't say that I can lean one way or the other, that Medicare Advantage definitely costs more money to Medicare, or it definitely saves more money or improves health outcomes. So it's pretty tight. Dr. Oz is adamant that it costs more money. So I'm going to take it at face value and say he's probably done the research a little deeper than I have and is correct on that. So if that is the fact, then definitely this conservative administration that's coming in, they are looking to shrink expenses, which means they're probably going to find a way to cut expenses in Medicare Advantage. So it's going to be really interesting to see how they manage that balancing act come 2026. We already have CMS proposed rules that are sitting out there. I talked about one of them, I think last week or the week before. There is still the previous one, if you may remember, from last year that never fully got taken care of. That is the one that's basically about hitting our compensation. All the TPMO to TPMO stuff, that one still hasn't been completely brought to fruition. So there is a lot of stuff on the table that could happen. And I would definitely, again, encourage you, right? Write your representatives, your congressmen, your state legislators, and tell them about the importance of agents in the Medicare program with working with beneficiaries, or even the ACA marketplace, whatever it is. Do that. I highly encourage you. And there are plenty of templates out there. You can talk to Galen Hendricks. You can talk to Ronell Nolan. You can talk to me, Rebecca Davis. We can get you a form letter that all you got to do is find out who your representative, send it right to them, sign off, and get it going. But I would definitely encourage you to do that. And not that this is also, I'm sidebar here, not that this is supposed to be a recruiting call for NABIP, the National Association of Professional Insurance Agents, or National Association of Benefits Insurance Professionals, but now is the time to fight. Like, if you're an insurance agent and you believe in what you do, you believe in your career, you believe that agents as a collective are working towards the betterment of health outcomes, the betterment of the beneficiary, right? The receiver of our products and goods. If you believe that's true, then you need to fight. You need to be prepared and start talking to your representatives, start paying attention to some of the things that are happening, so to make sure that you're voting correctly or that you're voicing your opinion correctly, all right, or your beliefs. Because one thing that is very true, your voice is the most powerful tool that you have. So now's the time to use it. Moving along, and I'm not going to dive super deep in this, but it's another really good one from Kaiser Family Foundation, although it is a bit of a speculation. And it says, will the Trump administration fast track the privatization of Medicare? I have a beef with the headline, number one. Medicare is already privatized. It's already privatized. It's been privatized since 1997 when Bill Clinton passed the Balanced Budget Act of 1997, which was the first time that it allowed Medicare to contract with private insurers. That opened the door. George Bush came in, turned it into Medicare Advantage. Obama came in 2014 and started funding the shit out of it. And then it's blown up since then. So to all of a sudden put like, oh no, the whole privatization on Medicare is going to be on Trump. No, it's not. It's been a bipartisan effort since 1997. Will he expand? That's what they should have said. Will he expand the privatization of Medicare? Very possible. And we don't know for sure. But it says right here then, and it does say, says the privatization of Medicare has been taking place without much public debate, a trend that has implications for the 68 million people covered by Medicare, healthcare providers, Medicare spending, and taxpayers. Since 2010, the share of Medicare beneficiaries receiving their Medicare benefits from private Medicare Advantage insurers has more than doubled. The Congressional Budget Office projects that nearly 2/3 of all Medicare beneficiaries will be in private plans by 2033. If the Congressional Budget Office is correct, and 2/3 of Medicare beneficiaries will be in private plans by 2033. I see that as opportunity. Assuming, right? I mean, Medicare Advantage is what it is. Whether you like it, you hate it, you feel like it's great, you feel like it's a problem, whatever. It's going to grow in some fashion and will continue to provide a product or an opportunity for us to handle enrollments. So I like that statement when I see it. Not that I necessarily believe that Medicare Advantage is the best option for a Medicare beneficiary. I think it certainly depends on a lot of factors. I'm not here to get into that argument with you, but it says pretty blatantly the Congressional Budget Office projects that nearly 2/3 of everybody of Medicare beneficiaries will be enrolled in private plans by 2033. Though data released in the early part of 2025 showed enrollment growth in 2025 has been a little lower. And they don't say why that enrollment growth is lower. It certainly could be to some of the bad media that's out there for Medicare Advantage. I'm of the opinion that it also has to do with just a little bit of the shakeup that's happening at the administrative level, the government level right now, that I think a lot of the T65s that are out there, people that are turning 65, are a little more nervous on giving up their group benefits and jumping over to Medicare. So I think that's part of the enrollment growth. I'm really curious. I'd love to see the T65 numbers this year because right now we are at the peak of that 10,000 per day. You've been hearing this for a while. I think the stat started getting tossed around sometime around 2014 or something like that, that we're going to have 10,000 people a day turning 65 for a period of about 9 years. And that 10,000 is an average. Right now we're at the peak where we're around 12,000 a day. So if we're at the highest point of people turning 65 every day, but we're seeing enrollment growth slow down in the Medicare Advantage space, I'm of the opinion that is because more T65s are pulling the reins back. They're hanging onto their group plan. They're working a little bit longer to see what the hell is shaking down, right? Because nobody likes change. Nobody likes losing things. So if anything is true, they're going to be a little concerned and they're going to hang on to what they know is currently working for them. So I think that's where some of that enrollment growth slowing down is we're seeing. But the article goes through some stats. It talks about some of the implications of Trump privatizing Medicare even more, growing it, right? So I will get this article in the group for you that you guys can check it out. But pretty much, I mean, it's almost already the default enrollment option. And they are saying that this administration could certainly accelerate that pace. And again, that was all of our belief at the beginning. As soon as we saw this administration coming in, we're like, holy crap, they're going to super privatize Medicare. They're going to grow Medicare Advantage, and they're going to deregulate all the bullshit for agents. Doesn't look like that's 100% true. I mean, the article that I just talked about Talked about Dr. Oz wanting to dig into Medicare Advantage and really pick it apart to reduce the upcoding, streamline the prior authorization. Now, if they can get those problems solved, right, and reduce the expenses to Medicare from Medicare Advantage, and maybe it's not costing more than original Medicare, then yeah, we're definitely going to see them blossom and scale it some more. But they have some challenges ahead of them first that they want to fix in the area of spending. Speaking of, CMS scraps contracts to upgrade online Medicare system and hands control over to Doge, the agency says. So if you're in the Medicare space, you already know this, that you can go to medicare.gov, medicare.gov. They have a plan finder tool that an individual can look up plans on their own, Medicare Advantage plans, prescription drug plans, and they can enroll themselves, right? That's what they're talking about here. So instead, CMS will work with the highly influential advisory group Department of Government Efficiency to complete a system overhaul that will be far less costly and time consuming, right? In other words, the contractors working to modernize the provider enrollment system have been shown the door. They're out. And Doge is coming in to now work on the online enrollment platform for Medicare.gov. That's both great and scary at the same time. And when I say scary, that's scary for agents, I would think. Right now we have these super tech geniuses that are AI driven, right? Madmen, smart people, absolutely. They're going to come in and overhaul the online Medicare enrollment system. I mean, these guys aren't chicken shit. I assume they're going to do a very good job at making that online platform super efficient, which means it's kind of spells disaster for us in some way, right? Because as an agent, like that's our thing. Like you need us to help facilitate that enrollment. But if they're able to get that platform running super streamlined, super friendly, and push it, this could definitely be a way that they see starting to phase us out in certain product lines. I'm just saying they're opening the door. I'm not trying to tell you that the world is crumbling. I think we still have many years as independent agents to work in the Medicare space before they either do away with us or we have to pivot in some direction or another. But a little quote here says that 2 contractors spent 9 years and $200 million working on a modern provider enrollment system at CMS. After 14 missed deadlines, 0 usable output was produced. CMS has now canceled those 2 contracts, saving $17.8 million annually, has hired multiple software engineers, and working with Doge are accelerating this project. So I'll get this up in the group too. You guys can check it out a little deeper, but basically they are coming after the Medicare.gov online enrollment platform. They want to improve it, streamline it, making it more customer friendly, more beneficiary friendly. And then finally, I found this article out there on Facebook somewhere, but it talks about the insurance industry faces 4 possible future scenarios. And it's a short article. There's not a lot of meat to it, to be honest with you. So I'm just going to run through it real quick. But it says the insurance industry faces 4 possible future scenarios. Insurance executives are optimistic about the major trends influencing their industry, but remain aware of critical risks to their organization. No kidding. A panel of experts reviewed the findings of the Economist Impact Research on the future of the industry during a recent webinar and said that there are 4 possible scenarios. Number 1, fractured resilience. Number 2, digital harmony. Number 3, adaptive alliance. And number 4, stagnant turmoil. 2 main drivers of change impact all of these scenarios: the pace of technological change and the level of global cooperation. Insurance executives surveyed said market dynamics and artificial intelligence are the most significant trends that could shape the insurance sector in the coming decade. Kind of agree with that. But executives also identified 3 emerging risks to the industry: climate change, cybersecurity, geopolitics. Optimism over AI. Many leaders are aware and optimistic about the use of AI in the industry. AI's cost-saving benefits held special appeal, right? But basically it says that AI can minimize underwriting and operating costs. It can help expand markets. It can improve information sharing, improve claim processing, and improve product deployment time. Key takeaways. Adopting emerging technologies requires adaptive behavior in the industry that has been slow to change. The rise of the middle class, especially in Asia and the Pacific, will drive demand for insurance as long as living standards improve. The industry is at an inflection point today, head of financial services said Andre Bellelieu. The industry is coping with many mega trends, many of which didn't exist 20 or 30 years ago, many of which increased. The industry is trying to adapt and remake itself across many areas. Insurance is central to the solutions we need to build for the world. The insurance industry is doing a lot of deep thinking around all those areas. Definitely so. And I think we, as long as you're not living under a rock, would agree with those statements, because if anything is true, we are seeing a lot of technology infiltrate the insurance industry in a lot of ways. At the easiest level was talk about some of the stuff insurance agents are doing now, right? Agents are now able to go get data, putting in a CRM, and have an artificial intelligent voice make outbound phone calls to that data, scrub it, find the gems in there, and then tee that up to agents. Like that's just one little thing that they can do. Like you guys know, like there's some amazing stuff out there for agents in regards to AI and technology that we are already using to speed up our processes. Certainly that stuff is happening at the higher levels, and it's going to continue to be a thing. A couple of things real quick. There was one question that I saw pop up in one of the groups that I wanted to talk about real fast, because this pops up a lot. This was a thing. I don't remember which group it was in, but it was in one of the Medicare groups that I hang out in. But it says, I am ready to pull my hair out trying to get my LLC set up with all these carriers and states. It's so confusing. Yes, it can be. The carrier side of it really shouldn't be the issue. Dealing with the other states is an issue. So real quick, I'm just going to lay out what you need to set up an LLC if you are an insurance agent and you now want to operate as a corporation, an LLC, an agency, whatever it might be. Super simple process. And I'm going to be on a virtual webinar event with Amanda Bruton and a group of people that and this is one of the topics that I'm discussing on that thing, is how to actually streamline your process and set yourself up as an LLC or an agency. It's not that hard. I think a lot of people overcomplicate the process, but it's super simple. Number one, if you're an insurance agent licensed in any given state, certainly your resident state, you can immediately convert to an agency. It's a multi-step process. The first thing you have to do is set up your LLC, right? You just need to get an EIN number. Go to your Secretary of State, shop for the name that you want, make sure the name you want is not taken, buy it, file for your LLC. You can file for the EIN. Like you don't have to go hire I would hire an LLC person. I know a really good one if you need help setting up your LLC, to set up the full LLC with the book, everything, like the whole thing, operating agreements, the whole 9 yards. Alternatively, you can just go and get you an EIN number. It'll take about 24 hours. They'll have it to you the next day. As soon as you have that EIN number, you can then go back to the Department of Insurance for your resident state and now use that EIN number to file as an entity, a business entity, an LLC, S corp, whatever you're doing, right? That's the first thing you need to do. One, you have to be an agent. Two, go get you an EIN number. Once you have that, you can file that separate taxpayer ID to set yourself up as a business entity. As soon as your business entity in your resident state is done, you can immediately go and file for non-residents if you're working in non-resident states. That's going to be a two-step process. One, you as the individual agent has to be licensed in that non-resident state. And then two, you set up your entity, your business entity in that non-resident state. For example, I recently added Delaware. I had to first file my own license as an individual in Delaware to get Delaware approved for me individually. Now that I'm an individual agent, I can come back behind that, file for my agency license in Delaware, right? If you're in the Medicare world and you want to operate as a business entity, you have to be licensed as a business entity in any state that you want commissions paid to your business entity. Hard line. No exceptions. You can't just assign the commissions out. So again, I'm just going to kind of repeat that process a little bit. Number one, you have to be an agent. Number two, get you an EIN number. Number three, file that EIN number with your resident state Department of Insurance as a business entity, right? Make sure you have a name approval and all of that. Once you have that set up, then go back to all of your insurance carriers and complete a brand new contract with your business entity information. It'll take the carrier the standard amount of time. They're going to flip it around. Boom. Next step, if you want to do this, get all of your old commissions assigned to your business entity now. That is a bit of a hassle. You don't have to go to that step, but if you want it, and I would advise it, that's another step. So once you have that business entity contracted with United Healthcare, Aetna, Prosperity, whoever the hell it is, then go back to that carrier and say, hey, what's the process for me to get all these commissions that I wrote while I was just an individual agent, Tony Merwin, assigned to my insurance agency, Go Ovula Insurance Brokers? They'll hand you a little bit of paperwork. Boom, bang, pow, done. Now, if you're a single member LLC, they might just tell you, oh, all we got to do is update the banking info, piece of cake, right? So some of it's going to depend on your type of corporation or LLC that you might set up. But for the most part, it's really that simple. The only other step, and this is going to vary based on states like Virginia, New York, Mississippi, Tennessee, I think, and there are a few others, where if you're a non-resident, you have to work through a designated producer, designated person that you can have, right? Some of those states require that you have someone that is domiciled in the state as a designated business or responsible producer, or there's some other terminology depending on the state. So in some cases, you may have to go through an extra step of having someone, right? There are a few agencies I use. Northwestern Registered Agents is one of the ones I like to use. They streamline everything. They make it super simple. I just turn it on auto renewal. And then every couple of years, they come back and they refile that registrant's address for me so that I can maintain that license in that non-resident state as a corporation. Pretty simple. Next up, I got one more big thing that I want to talk to you guys about. Let me bear with me while I get this on screen and share it with you guys. And you'll have to apologize that I'm doing the whole thing here, but give me just a moment to get this on screen. Goodness gracious, what are you doing? All right. So this ad, share screen. Yeah, here we go. So this was posted in one of the groups yesterday, the Medicare Monsters group. Check it out. It says Medicare, and I'm going to see if I can zoom in on it a little more. Is that better? Yeah, that's better. Check this ad out. It says Medicare covers groceries now. Get information about Medicare's new grocery benefit program to help with food cost. Medicare.gohealth.com. Click now. Does Medicare cover groceries? I didn't think they covered groceries. Go Health says they do. So this ad's causing a little bit of stir because anybody that has any semblance of idea of what the Medicare marketing guidelines are would tell you that that is an uncompliant ad. Every agent that I'm seeing comment in the group about this ad is like, this is bullshit. I can't advertise like that as an agent. I can't say that Medicare covers groceries now. Medicare doesn't cover groceries. There is a food card and there are some grocery benefits that you can get in Medicare Advantage plans. And anybody that has a brain in the Medicare industry knows that's what they're driving at. But it's kind of garbage, you know, and I know it would upset a lot of agents, but here's a few thoughts. Number one, this is an approved ad, right? Like the first thing we saw, like when this picture got posted in the group and people started sharing, like, they're like, who do I need to report this to? Because this is garbage. Who do I need to report this to? And we're like, well, you know, reporting it, I don't know if that's going to really do you any good, because generally a lot of us are of the belief that if you report agents for malpractices to CMS, all you're doing is creating more regulation on us. And I made a comment because as soon as this popped up, I happened to be standing next to a high-level vice president of a major insurance carrier in the Medicare space. And I showed him this picture. I was like, check out this ad from Go Health. What do you think about it? And he looked at it and just kind of shrugged. And he's like, I don't know. He's like, I get it, but I don't have any answers for you. Well, understood. And I didn't necessarily expect him to have answers. There's not much that he can say about it, But the truth is, this is an approved ad. Go Health went and filed this with Medicare, and they approved it. And that's why I really appreciate my buddy Joe Tertola's comments in this post, because he said, open up the ad, look at the bottom, and see a code with either 2024 or 2025 and the word multi-plan written on it. And you will see that that means it was approved for marketing use. In other words, you would see that picture right there. You can see at the bottom, it says multi-plan, Go Health, blah, 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 2024. That means that ad was filed with CMS and approved. Interesting. Part of me, like, I don't ever want to run an ad like this, number one, because this isn't the group of people that I'm trying to market to. I really don't want to market to people that are attracted to the grocery benefit program and need help with food costs. I don't have anything against those folks. I'll take care of them. We have plenty of decent people that we talk to, and we've had people ask me about these types of benefits, but this isn't the way I would market. But I kind of want to file an ad like this myself to see if I can get it approved. Like the conspiracy theorist in me says that if I filed this ad with anybody, it's probably going to get rejected. Maybe it wouldn't. Right. And if you're an agent out there and you want to do ads like this, like, write them up, file them, see if it gets approved. I mean, but the truth is, whether we like this ad or not, whether we believe this ad is factual or not, and I would think everybody would say it's absolute bullshit, because Medicare does not cover grocery benefits. Medicare Advantage plans do as a supplementary benefit that they use, and they pay out of the money they get from Medicare. Medicare offers zero grocery benefits. So this is, in my opinion, is bait and switch false advertising, right? They're getting people to call in about Medicare's food program, and they're like, oh, well, Medicare doesn't have a food program, and, well, you actually don't even qualify for Medicaid, but since we got you on the phone, let's sell you some damn insurance anyway. And that's pretty much what they're doing with these types of ads. But again, it's approved. So if this is the group of people that you want to market to, go create your own ad like this, file it, get it approved. Otherwise, what good does it have to bicker over it? I mean, it is what it is, but that is that. So with that said, that's really about all I have for today for the most part. I did want to just take a moment, since we got a few things. If you guys have any questions, drop some questions in the comments. If you have something you'd like to ask me. Other than that, I'm going to reiterate the Medigap script that I talked about last week a little bit. For simplicity purposes. Again, and this was something that we were actually doing an exercise. Let me backtrack a little bit. We were doing an exercise yesterday with my team here in practicing on overcoming objections in different ways. So one of the first things that we did is we said, hey, what are all of the value adds that GoAvila or Avila Medicare Solutions can offer to a client? Like, what are the reasons why a beneficiary should do business with us versus yada, yada, yada. And I had my agents kind of go through that. We talked it over. We made sure that we had a good list of things, because what I'm trying to teach them is how to use that list to battle against objections, right? They use the agree, answer, ask method, grab one of those value-added benefits, plug it in, and then try to move back on the track. But the reason I brought that up is because one of the value adds that we talked about was educating seniors, right? Or simplifying the enrollment process. And I said, simplifying is great. Educating seniors is great. But think about that at another level. What are we really doing? We are empowering seniors to be able to be a more educated consumer, to make better healthcare choices in their, or better insurance choices, I should say, in their healthcare plans. So, and that's a big part of what we do as insurance agents. We simplify the process and empower the beneficiary to make better decisions. That's one of the reasons why I believe in that Medigap script that I talk about, that I use when I talk to consumers. It is a simple script. It cuts through all the bullshit. It cuts through all the noise. It gets it right down to just a short conversation. They totally understand what I'm talking about, and they can make an easy decision. And again, I take it that way because, number one, I'm the licensed expert that's been doing this for 20 years, not my beneficiary. My beneficiary is an expert in knowing what they want, and I can use good discovery questions and a needs analysis to get that information from them. And then because I'm the licensed expert, I can find the right product to position as the answer for that, right? And because most of the business that I personally write is one of two people, most of the time it's someone turning 65. The majority of the referrals I get are turning 65 folks, whether they're coming from my BNI group or they're coming from my current client base, right? And most of those people, by and large, almost all of them, are enrolled in a Medicare supplement plan. And usually with a drug plan, usually with some dental vision, sometimes with some cancer, sometimes with some home health care. Just depends on who they are and kind of what their desires and needs are. So when I get those referrals and I get that, I already kind of know a little bit of the direction they want to go. And with a couple of simple questions up front, I can decipher that this person is likely going to be more happy on a Medicare supplement plan, a Medigap policy. So I'm going to simplify the conversation. The biggest thing that I said, I think probably the biggest takeaway from what I said last week was if your goal in your business is to sell product A, I don't even know if that's the right sign language for A, probably not, right? But just follow me along. If your goal is to sell product A, why are you introducing product B into the equation? Now, the only reason that might work is if you're introducing product B as a substandard product in order to lift up product A to help you sell it. But if you're introducing them both on equal playing grounds and you're like, here you go, here's 64 Medicare Advantage plans to look at, here's 10 different Medicare supplement plans to look at, and you're describing them on an even playing field, and it's like, here you go, Mr. Consumer, which one do you want? You're going to get shit back because they're going to be confused as hell. They don't know what they want, and they may not pick the right plan for them. I understand that Medicare tells us we can't be biased and we can't coerce people into buying one plan or another, but all of those rules only apply to Medicare Advantage again, right? All of those Medicare marketing guidelines, all of the compliance restrictions, everything that we're all concerned about as insurance agents to make sure we don't cross the line, step on anybody's toes, and get ourselves in trouble. It all applies to when you're presenting or enrolling Medicare Advantage or prescription drug plans. None of that shit applies to Medicare supplements, number one, right? So when you're promoting a Medicare supplement plan or you're working with your clients, you can pretty much say whatever you want when your presentation is wrapped in the Medicare supplement world, assuming obviously that you're not lying and you're being ethical, right? But going back to it, like I would never, if my goal is to sell this product, I'm not going to introduce a second product in the equation or the conversation and put them on an equal playing field at all. If I'm introducing that second product, it's only going to be in an effort to disparage it so that I can lift this one back up and increase the likelihood that I'm selling Medigap. So that being said, if you want to sell Medigap plans, either A, only talk about Medigap plans, or B, when you talk about Medicare Advantage, put it in the right light that shows that Medicare supplement is, in your opinion, the better product. And there's nothing wrong with having that opinion, right? Again, that is not a national opinion. If you're in Miami-Dade, you're going to have the belief that Medicare Advantage plans are better, and you'd be right, because you can get them for a $300 MOOP down there with 000, and everybody accepts them. You go to LA, same thing, right? But if you're in rural Texas or even central Texas, like where I live in Travis County, big city, plenty of Medicare Advantage plans, but they're all $6,800 MOOPs, $5,000, $7,000, $9,300 MOOPs with smaller networks. Why? I mean, Medicare supplement's the way to go. I can set myself up for about $1,200 a year or less and have an outstanding plan that I don't need referrals. I don't need permissions. I can see anybody I want nationwide. So depending on where you're marketing, it's okay to have an opinion that one product is better than the other. And once you believe that, like, oh, I believe this is a better product for my clients, then just sell that product. You're the expert. steer them into that product. We're not supposed to steer Medicare beneficiaries, but again, we're not supposed to steer them in the Medicare Advantage world. I'm not supposed to steer them to United Healthcare because I don't like WellCare or because I don't like Aetna, because maybe they don't pay me as much. Maybe I don't have as good a contract there. That's where the steering is a problem. But when I talk to a new Medicare beneficiary and they're like, hey, what's going on with this Medicare thing? I can steer them to a Medicare supplement plan all day long, 100% compliant. And I don't have to explain all 10 Medicare supplement plans. I can simply tell them, hey, this is how it works. This is why most of my clients choose this. This is how much it would cost for you. Does that sound like it's what you want? 9 times out of 10, they're like, yeah, sounds great. So I'm going to say it one more time. This is exactly how I say it to people. Right. And I have a new T65 that I'm signing up today. And I've already gone through this with her. We've already have the bundle done and everything. And I probably will come back and do some more bundling workshops with you guys on here. But pretty simple. I'm just going to say, hey, Danette, her name is Danette. Hey, Danette, right? Now that you have your Medicare card, I just want to go over a couple of things with you. That card gets you national access to all providers and doctors, 99% of them, except Medicare. Even if you go to Puerto Rico, the card's still good. So from an access standpoint, you have amazing healthcare because you can visit any doctor you want in all 50 states that accepts Medicare. 99% of them do. You don't need referrals. You don't need permission. However, the caveat is it's going to function a lot like an 80-20 plan. So when you use that red, white, and blue card, you're going to pay 20% coinsurance for any hospital or medical service. I don't have to tell you that 20% of a hospital bill or 20% of a surgery or rehabilitation is expensive. You already know that. You're not an idiot. Now, since most of my clients, and that's that phrase, you got to learn that phrase, most of my clients. Since most of my clients don't want to pay 20% co-insurance for a hospitalization, they buy a low-cost Medicare supplement plan. I quote the rate for the plan that I believe in, and then I ask the person if they think that's the type of healthcare they want. That's it. Like, it's that super simple and easy. I'll say it one more time. Hey, Danette, now that you have your red, white, and blue card, I want to go over a couple of things with you. That card is actually really good insurance from an access standpoint. It's accepted by 99% of providers in all 50 states and Puerto Rico, and you don't need permission or referrals. If you know a doctor that accepts Medicare, just make an appointment and walk right in. Now, the caveat is it's going to function very much like an 80-20 plan, which means for any medical or hospital bill that you have, you're going to be on the hook for 20%. And what's most important to understand, that 20% is uncapped. There is no maximum to it. Now, I don't have to tell you that 20% of a surgery or a hospitalization is a lot of money. But since most of my clients don't want to be on the hook for a 20% coinsurance, they'll purchase a low-cost Medicare supplement plan, which for you would be $71.76 per month. That'll reduce that 20% down to a $257 annual deductible. You can still see any doctor you want nationwide that accepts Medicare, which, as I mentioned, was 99% of them. Does that sound like the type of healthcare plan that you would want? Yes. Okay, perfect. Take me a few minutes and we'll knock it out. Boom, my Medicare supplement is sold. Like, it's superly that simple, right? We can take it another level. Check out my Bundle Mania ones. I will bring those back, but we are out of time today. But the same concept, like, and I've already done this with this lady, right? I've already gone through my bundling script. So when I get her on the phone, either today or tomorrow, I'm not sure when our next appointment is. She's deciding, but she's going to buy a Medicare supplement plan. She doesn't even know what plan letter she's buying because I didn't tell her. I just sold it because it's unnecessary. I need to tell her the benefits, right? She's buying a Medicare supplement. She's buying a dental. She's buying a vision. She's buying a drug plan, and she's buying a cancer plan. Because I bundled them all in a really simple script. You guys have, if you haven't seen my Bundle Mania, I've got maybe 3 or 4 videos on the YouTube channel and in the group that are talking about how to bundle with Medigap sales. Go check them out. It's super simple. I'll bring it up again, but for today, that is the show. Have an awesome Tuesday. I will see you guys on the flip side for Tuesday training again.